Hi. Hi, this is Irene Owens, and this is the nursing process. I don't want you to get too scared because there's quite a few slides on the nursing process, but I've kind of broken them down into the chapters. If you'll follow me along, if you take a minute, just go ahead and get your Fundamentals of Nursing book by Wilkinson out, and if you would, turn to Chapter 2, and that's where I'm going to be starting. We're very, very excited that you're here. We're glad that you have come all this way, and we're very excited that you're part of our new hybrid class. So welcome. You have a lot of support, and if you have any questions or concerns, make sure that you ask us. Okay, so let's go ahead and get started. Chapter 2 talks about critical thinking in the nursing process, and I don't think you can really talk about the nursing process without talking about critical thinking. And if you ask yourself, what is critical thinking? You hear it, you've been told about it, but you have to look at it and say, what are really some definitions of critical thinking? If you look in your Wilkinson book, it's on page 27, it's box 2-1, it gives you a variety of different definitions of critical thinking. And if you look at the very last one, it states that the ideal critical thinker is inquisitive. That ideal critical thinker is open-minded, flexible, fair-minded, well-informed, persistent in seeking the truth, wise in judgments and decision-making, logical and honest with facing personal biases. So the critical thinker uses sound reasoning and is willing to consider valid alternatives. And to me, after I read all of those, that was my favorite one, because when we go through life and we go through nursing school, and every single day that I practice in my clinic, I am always trying to be very inquisitive, always trying to make sure that I have a curiosity about patients and about what's going on. So it's something that's lifelong. So what are critical thinking skills? You may ask. What is that? There's a few examples on page 27 that give you some skills that you may look at and say, well, I have that skill. No, I don't have that skill. I need to strengthen one skill or the other. And the very first one is objectively gathering information on a problem or issue, recognizing the need for more information, evaluating the credibility and usefulness of sources of information, recognizing gaps in one's own knowledge, listening carefully and reading thoughtfully. I think that right there captivates one of the best nursing skills that you can possess, and that's listening. Because most of us don't listen. Most of us like to talk. So, and if we listen, usually patients will tell us what's wrong with them. And if we have that caring attitude, then they will feel comfortable doing that with us. Another one is separating relevant from irrelevant data, like important from important, organizing or grouping information in meaningful ways, making inferences about the meaning of that information, visualizing potential solutions to a problem, and exploring the advantages and disadvantages and consequences of each potential action. So those are some of the skills, and you utilize those skills in your practice. When you read those on your own and you go over this, make sure that you say, okay, I do that very good. I do that. Maybe this is something that I need to work on. and I look at that in my own practice every single day. So what are critical thinking attitudes? And if you look, some of the attitudes on page 28, the first one is independent thinking. You can't believe everything that you're told. You can't just go along with the crowd. There's going to be, have you ever, had a situation where, somebody told you something and it was not true at all. So you have to make sure that you do not believe everything you're told. Intellectual curiosity, you have to love to learn new things. And I love that. I love to learn new things. And I know that from teaching, it's a wonderful profession in that I learn from you as much as you learn from me. So those are things that we always need to be curious, and we always need to ask those questions. How come? What if? How could this be done differently? Or how does this work? Or how come that happened? So I love that part of critical thinking. And the next one is intellectual humility. Critical thinkers are aware that they do not know everything. And I know that I don't. And the more I have learned in my life, the more I know how much I do not know. We also, as another attitude of critical thinkers, are intellectual empathy. Critical thinkers try to understand feelings and perceptions of others. So they try to see the situation as the other person sees it. And also intellectual courage. Critical thinkers consider and examine fairly their own values and beliefs as well as the beliefs of others. And intellectual perseverance. Don't jump to conclusions. They don't jump to conclusions or settle for the quick, obvious answer. And the last one is fair-mindedness. Critical thinkers try to make impartial judgments, and they treat all viewpoints fairly. So those are some critical thinking attitudes that I think we can all kind of keep in mind as we try to develop more and more critical thinking skills. And these are some attitudes that we can try to emulate as we go through our nursing career. So when we pose the next question is, why is critical thinking important? And I think that's a, sometimes I think, oh gosh, that's really a no-brainer. But, I've looked at my own career, and, I always say 30,000 years ago when I began in the nursing career, my nursing practice, I didn't deal with the complex situations and the complex acuity of patients that you are dealing with when you get out of, or when in your practice now, or when you get out of school. So nursing is dealing with very, very complex situations, and all clients are very, very unique. Everyone is different. That makes critical thinking very important, because you don't want to be unfair-minded. You want to be open to other people's cultures. And usually it's just about asking a question. Tell me about where you were born. Tell me some of your practices for your religion. I've never heard of that religion, or I've never met anybody from, let's say, India. So those are questions that you can ask patients. And nurses need to apply knowledge to provide holistic care. Very, very important. it's about the mind, the body, and the spirit. On page 31 in Wilkinson, it gives you, and I love this little table, it's a critical thinking model, and it has some questions for focusing your thinking. I'm not going to go over all of those, but I think it's just a good place to say, okay, if you're in a situation or if you need guidance about what's going on in a certain, work-related or even a personal situation, those are some questions that you might could ask yourself, and kind of gives you it gives you a direction. So you can go over those on your own, but we're going to go ahead and go to the next slide. Okay. So we have a basic understanding of critical thinking, and so then we go to the nursing process and we ask ourselves some other questions. And the first one is, what is the nursing process? And there's a few different definitions of the nursing process, and I've given you a couple of them, and they're supported by the American Nurses Association and even the Canadian Nurse Association. So when we look at it, we define nursing process as the nursing diagnosis and treatment of human responses to actual or potential health problems. Another way to look at it is systemic problem-solving process that guides all nursing actions. Both of those definitions are very, very important, and when you are looking at how to diagnose without using a medical diagnosis, because we diagnose based on, and just remember this, we diagnose based on human responses, not on the medical diagnosis. Medical diagnosis is from a medical standpoint. If I have strep throat, we're looking at the treatment of the human responses to the strep throat, which would be, maybe difficulty swallowing, maybe having some airway problems, things like that. I think it's important to know that the American Nurses Association organizes its standard of care around the nursing process. So it's not something that's just it's not just a theory. It is a organized standard of care that a lot of our associations take to heart when we are doing our care for patients. So the characteristics of the nursing process are within our legal scope of practice. They're something that we do that is a planned process. It's based on knowledge, and it is research-based. It is always patient-centered. It is goal-directed. It's prioritized, and it's forever changing. And that's the beauty of the nursing process. Always changing, because patients are always changing. You can check them 1 minute, the next minute they're not doing as well as when you saw them the last time. So the phases of the nursing process, and your book goes over that if you want to read a little bit more in depth on page 33. The steps of the nursing process of the first one, and we're going to go over each one of these individually, so I'm just going to kind of tell you what they are, and then the rest of the PowerPoints are going to tell you, we're going to break every single one of them down. So the first one is assessment, diagnoses, planning outcomes, planning intervention, implementation, and evaluation, which is the final phase. This just is a schematic about how the nursing process works, and with critical thinking in the middle. And a lot of times, instead of the nurse in the middle, we're going to pretend like this is the patient, because all of this is revolved around patient care. This is another little schematic just to help you about how critical thinking is related to the nursing process. And there the client is right in the middle, always. So I don't think we can talk about the nursing process without talking and critical thinking about talking about what is caring. Caring involves personal concern for people, events, projects, and anything. It allows you to connect to others. Caring is something that I do not think can be taught. It's something that occurs, and it is the basis for nursing. If you look at your book goes over what is full spectrum nursing, and there's a patient situation, number 1, that's on page 36 in Wilkinson, and it kind of gives you an idea of how this model works as we utilize critical thinking, the nursing process, and caring all together. And I'm going to let you go over that yourself and read that, and it goes over your thinking, your doing, and your caring, and how it all works together. Because without all those 3 steps, we could not be delivering really good nursing care. And I just kind of put this in as, at the end of this part 1 lecture, nursing process, and hopefully this is not what our future is going to hold. You see the little guy, he's in bed, he can't get up, and he gets on the phone and says, press 1 if you have bed sores, press 2 if you need to go to the toilet. So we hopefully nursing will never ever be like that. Okay, that's the end of part 1, and part 2 and 3 will be included this week, and then parts 4, 5, and 6 will be the nursing process lecture will be for week 2. Okay, have a great day. Thanks.